You want a better smile, but you're not sure what it's going to look like? Well, you can get a really good idea by seeing all the before and after examples at one particular dentist's office. We're spending time with Dr. Stephen Marsh here in the reception room of his office. Dr. Marsh, we walk in, we immediately are greeted with all kinds of smiles, before and after smiles on the wall. You've got books full of them. Why is this so important to you?
Well, I think a lot of people come to us and they have a sense of what they would like to have done, but they may have not been able to imagine what it looks like. Well, in 46 years, we've taken care of lots of different teeth, lots of different smiles, so I think it gives them a sense of what can be done regardless of what they come in with.
Well, let's take a glimpse or a deep look, if you will, at some of the patients that you've helped. Who are we starting with?
Yeah, we're going to start with our board right here, Joe.
Okay.
So our first patient is Cheryl, and Cheryl actually was encouraged by her husband, and for years didn't like her teeth. Her sister had been a patient here, so she had a sense of where she wanted to come. We started in the upper arch, Joe, and she wanted a big, broad smile. She also talked about what she wanted in terms of color. We have a lot of different shades we can pick. She said, for years, I've not liked the dark color of my teeth. I haven't liked the shape. So we went with 6 porcelain veneers for now, Joe. We'll do more in the future. But she had actually looked at some of the pictures that resembled her mouth and said, that's what I want. And she was able to point to it. Made it easier for me.
Yeah.
Laura, a different story. Laura was 20 years old. She was born without a tooth, and another tooth came in. It wasn't the right shape. She had been through orthodontics, Joe, just to set those teeth up in the best position that we could get. She came to me after that and said, let's see what we can do. We used a porcelain zirconium bridge to close the space. We used some veneers to give her a space that she said was remarkable. And she had seen some of our patients who had also been missing teeth, both on the wall and on a couple of our segments. So this is Norma, Joe. Norma was in her 70s, and she came to us and never liked the way her teeth looked. And she also wore a partial denture on the lower that went in and out. And I said, you know, that's sort of old school. We can do something different. We used some bridge work on the bottom, and we remade her upper teeth. We did some porcelain veneers. She said she feels no longer like 70. She feels like she's in her 50s, and also had seen some of the things we had done and wanted to move forward.
It just goes to show you, no matter what your age, you can help.
Yeah, that's right, because we talked about Lana, 20. She's in her 70s.
Right.
And Michelle was in her 60s, so she's sort of an in-betweener. She also had a partial that went in and out. Never liked her teeth, and this is a situation where, again, the encouragement came from her family that said, you've taken care of everybody else, Mom. How about taking care of yourself? So in the upper arch, we did some porcelain veneers. We also did, again, that zirconium bridge. It's all porcelain, no metal. We can do that with today's materials. And Michelle said, I almost look like the people on your wall. So I think she looks just like the people on her wall. And in fact, we put her picture up so that she could also show what can be done in dentistry today.
Well, if you want a smile that's wall or book ready, Dr. Marsh and his team are waiting for you. Simply give them a call at 440-461-1003 or log on to the website clevelandsmiles.com.